Hello dear friends. Today's topic of discussion is going to be on dyslexia. Before starting this topic, I would like to thank Dr. Srinivasa Raghavan. He is the one who sparked my interest again in developmental pediatrics, and he was the one who took initiative to teach few pediatricians like us in small snippets about what developmental pediatrics is all about. His passion, how to tell this, his passion pushed me to do this class, to be very honest. So thank you, sir. So let's get on to this topic. I think this is one topic that actually gives us little bit fear, correct? It was like that for me, to be very honest. Okay, I was not very confident in developmental pediatrics. I am still not very confident, to be truthful, but I am trying to get better. I am trying to learn. So I thought I will take this class so that you will also learn what I have learned so far. So what is dyslexia? See, dyslexia is defined in these 3 points. Okay, it's unexpected difficulty in reading for an individual. Why is it unexpected? Because intelligence does not seem to suggest a difficulty in reading for that person. Okay, there is a difficulty in phonological processing that results in difficulty in speaking or difficulty in reading and writing or spelling mostly. These are the problems. So unexpected difficulty in reading for an individual where the intelligence is suggesting that the person is a much better reader. This difficulty is due to processing, difficulty in processing the phonemes, difficulty in processing the phonics, resulting in a problem in speaking, reading or writing or spelling. So basically there is a developmental uncoupling between IQ and reading. In a normal child, what happens if this is the flow chart of age? You have intelligence growing continuously. You have your reading skills also closely following the intelligence. What happens in a child with dyslexia? The intelligence increases similar to that of a normal child, whereas the reading skills do not follow the intelligence line. Hence there is a uncoupling, okay, developmental uncoupling between IQ and reading. This is a part of a large umbrella which is specific learning disorder. Specific learning disorder is something that impedes the ability to learn or use specific academic skills like reading, writing or arithmetic. Here the main problem is phonological awareness. What is important for a child to learn? Only if you know that, you will know what is going wrong in a child with dyslexia. So you need to have good sensory inputs. For sensory inputs, you need good eye, good ears. If it is not looking like ears, imagine it is looking like ears. Okay, and the child should have attentiveness while being taught something, and later this should end up in processing and synthesizing information, and finally application when asked to do so in a non-verbal format or a verbal format. For all of these steps to happen, this child should have a conducive environment and also motivation to learn more. What is happening in a dyslexia child? The eye is okay, the ear is okay, attentiveness is also okay, but the problem comes in processing and synthesizing information. So a specific learning disorder basically happens in a child with normal IQ, normal sensory inputs, normal instruction is being given to them or normal teaching methodology compared to other children. They are well motivated and they are provided adequate opportunity, but still they have a problem in giving output or receiving input. Then that results in a specific learning disability. And usually this may not be the norm, but usually their academic achievement is at least 2 grades below that of expected based on IQ. The IQ may look good for appropriate for age, whereas the academic excellence or the scholastic performance usually lags behind. They are good in socio-adaptive and motor development, but they are not very good in scholastic performance. Epidemiology wise, 50% of children with one affected parent end up with specific learning disability, or to be more specific, dyslexia, as this topic is about. 50% of siblings, nearly 70%, 68% of identical twins have dyslexia. In an affected child, if you go back to the parents, 50% of parents may have had a dyslexia. The gender difference does not exist, but the rate of picking up happens more in males because they express their inability to understand or put out what is asked for. They act out. Okay, since they are unable to achieve what is asked of them, they act out more compared to female children. Hence, more chances of a male child being picked up as having dyslexia compared to that of a female child, even though the incidence or prevalence is equal. Dyslexia is the most common specific learning disability, and this is maybe one of the most common neurobehavioral disorder. What is the etiology? You cannot pinpoint saying some X gene has mutated resulting in dyslexia. No. For you to have a reading or writing skill, it is a complex trait, and complex trait requires inputs from multiple genes. So, if multiple genes go haywire, then you end up having dyslexia, not one or two. Okay. What happens in the brain? Okay, right, multiple genes have gone wrong. All right. If genes are all right, then how is it being processed? How is it being processed in you and me? See, this is the brain's left hemisphere. Okay, this is left. You have three areas marked. The one marked in red is the inferior frontal gyrus, which is Broca's area. It's important for word articulation. The two posterior areas here in the occipitotemporal regions are for word analysis, and another one is for rapid automatic fluent word identification, which is fluency. These look similar when they are actually not. This is used for say if a word is banana, the person or the child will try to analyze what it is called as based upon phonemes. Okay. Second one, the green one is you just seeing the word and saying this is banana. See, you have been listening to me for this long time, isn't it so? So, if I underline this word, you don't take even a moment, you don't even hesitate a second to say this is pathogenesis. Correct? You look at it, you automatically recognize it as the word pathogenesis. Correct? That is fluency. That is rapid automatic fluent word identification. This happens later on. But what happens early on is the analysis part. This is I, this is in. How is it phonetically sounding? E, n, together it is called as in. That is word analysis. This happens early on. Letter to sound connection. Okay, this is the most important stage in the first and slow learning period, the earlier period of life. This is what happens in a normal or a typically developing child. For reading, what is important? You have letters, correct? And these letters in our brain should be associated with sounds, linguistics or phoneme. And when these phonemes are put together, that results in words, and that gives a visual image back. The brain gives a visual image back that corresponds with the word. In a dyslexic child, the retrieval of the sound of word is difficult, or retrieval of sound of letters is difficult, making the rest of the process very difficult for them. So many words I am telling, phonology, phoneme, phonics, they are slightly different. Phonology is the study of speech sound and pattern. So this is probably the umbrella term. What is phoneme? Phoneme is words are made up of individual sounding units. Okay. So if I say banana, it is made up of ba-na-na. So there are three individual sounding units. There are three phonemes in the word banana. Got it? So each phoneme has a distinct articulatory feature, meaning ba is made with both your lips together. Correct? And lips, can I say lips? Ba is not directly touching, isn't it so? You are actually touching the part above the lips. Na is made with tongue. Ma is made with your lips actually touching together. Ta is your tongue touching the palate. So each one has a distinct articulatory feature. So for a child to recognize phoneme, only ears are necessary. The child need not know the language, need not know the letters. It's enough to recognize that each phoneme sounds different. Okay. So this is oral language. You need not know the alphabets and only ears are necessary. For example, in cat, k, a, it. So there are 3 phonemes. What about mat? A, it. Mat. So the child need not know these alphabets. If you say mat, it means a, it. Put together it becomes mat. So this is the first step in a child developing a recognition of a phonemic part of a language. Whereas phonics is association of letters with sounds. Okay. So for this you need to know the letters. Letters are graphemes, sound or phonemes, put together it becomes phonics. So for this you need both eyes and ears. Eyes to recognize the alphabets and ears to remember, or the brain to remember what that alphabet sounded like. This is the next step in a child developing association between letters and sounds and putting together and forming words. What happens in a dyslexic child? The Broca's area remains bright in a child with a functional, when you do a functional MRI in a child. Whereas this posterior region in left hemisphere is silent. There is under functioning of left hemisphere posterior regions. This is the classical neural signature in a child with dyslexia. Okay. Left hemisphere posterior regions are silent. Left hemisphere. So they may understand what is being told to them. Okay. But if you ask them to split it into phonemes, or if you ask them to read it out when you give them a printed format, then they find it difficult. If you give a picture of the same, they may be able to tell it. If you give a printed format, they may not be able to tell it, because they cannot connect the sounds to form words. So alternately, they will try to use the right hemisphere's posterior regions for visual recognition. So as time goes by, the neural plasticity happens, isn't it so? Neuronal plasticity happens, and if a child is being trained from younger age on, they improve their reading skills over time, but the fluency will still be slow. It will not be fast. Okay. So that is why dyslexic adult, if you see, they will be able to communicate well. Yes, they may be able to read well too, but the fluency might be slow. They may not be as fast. So the problem here is print decoding, basically printed letters decoding. So how will the child manifest with? They will have problems in spoken language, as in they will be able to speak, but it might be mispronounced. There can be a lack of fluency. They can have word finding difficulty. These problems do not suggest the child is having a lower IQ. Their knowledge is good, their semantics are good. The problem lies where they are not able to connect the sounds to put out the words. Okay, only if that connection part happens, they will be able to form words. And problems in written language for obvious reasons. The listening comprehension part is good. That is why the use of audio books in children with dyslexia is gaining more and more importance nowadays. They improve reading accuracy over time, but not fluency. They like to listen rather than read aloud or play rhyming games. So generally these children have poor academics, but normal socio-adaptive skills, normal IQ. They are generally considered smart and they have normal development. How do you diagnose this child? It's basically a clinical diagnosis. You do not have any specific investigations to do it. The best person or the first person usually who picks up that there is something different about this child, something atypical about this child, is the teacher. I am specifically avoiding the term abnormal, okay, because they are atypical. They are normal children, that is what I feel. Okay. So clinical diagnosis of phonologic deficit has to be made. How can you make that? You can ask the child to read from an age appropriate book. You will find that they try to read it slowly with difficulty, and similarly with writing too. They hesitate a lot and they mispronounce a lot, and they will try to do repeated attempts to sound unfamiliar words. Okay, but generally they will have good vocabulary, syntax and higher comprehension, but these are the problems. Okay, the only thing that I want to tell is, when you ask a child to read something, it should not be words, it should be sentences. You should ask the child or the adolescent whom you suspect being dyslexic to read a sentence rather than a word. If you ask them to read a word, they will be able to do it, but that just tells you whether they have read the word accurately or not. But here you want to know the speed, you want to know the fluency. For you to assess fluency, it should be in sentences, and it should be timed tests preferably. Compared with normative or typical reader, how does a atypical reader do it? How does a dyslexic reader do it? So examples of some timed tests are TOWRE, TOWRE, I don't know how to pronounce it, test of word reading efficiency. Another one is Nelson-Denny reading test. So these are timed tests with which you can assess how fluent the child or the adolescent is in reading it. So now you have picked up a child who is possibly a dyslexic. Depending upon how early you pick up, the outcome will be better. Early on, you can remediate the reading problem by giving focused importance to them recognizing different phonemes and phonics. So early language and phonologic skills, even in a child who is dyslexic, is definitely shown to give improvement later on. A middle school child or a child who is a toddler or a early childhood child, how to put this? Early school goer, yeah, let's put it like that, early school goer. So you need the school to provide some accommodation for them, not bench and chairs. I am not talking about the physical one, I am talking about time. Time is probably one of the most valuable resource a child with dyslexia can have. You need to provide them with systematic instruction in 5 areas, because all 5 areas, each child is different and they will have different difficulties in each of these areas. So the treatment or the teaching should be tailored specifically for each child. Phonemic awareness, phonics, fluency, vocabulary and comprehension strategies. Phonemic awareness is where you start teaching them about phonemes. Cat is k, t, then mat is m, t. So just 1 or 2 phonemes you take and you manipulate them in different way to teach them how each is different and how they can combine them to form words. They need not know the alphabets, it's just phonemes here. So you can ask them, so if I say door, what is the starting sound? D. D is the starting sound for door. If suppose I say bed, what is the starting sound for that? It is B. And you can similarly ask them for final sounds. If I say door, what is the final sound? Final sound is R, isn't it so? Then you can ask them slowly to blend 2 phonemes. You can say, so if I say m, at, if you put them together, what do you get? That is blending. Similarly, adding, if you add ik to at, what happens? It becomes cat. Substitution, if the cat becomes, if instead of ik I put im, what happens? It becomes mat. And deletion, similarly you can give them a word like enna word kudukalam. So if I say pen, if you delete the initial part of p, only n remains. So these are all phonemic manipulations that you can do to make them aware of different sounds and how they can be used in different ways. Next you will introduce them phonics, where the letters are linked to sound. Okay. So you will ask them, you will teach them, see a can be pronounced as a. That is probably the downside of English, I would say, compared to some of our native languages. Because even though the alphabets are only 26, phonemes are nearly 44, 45 and the way that you can pronounce them is more than 100. Okay. So, see for example, you generally pronounce it as ik, but when it comes with a H, you pronounce it as itch. You get my point, right? So you need to take time, you need to sit with them, and you need to spend some time, and you can teach them segmentation. You can teach them the spelling pattern by using different colored segmentation. Banana, instead of teaching them as B-A-N-A-N-A is banana, you segment them with different colors and tell them this is ba, this is na, this is na. If you put them together, ba, na, na. So that becomes a banana. You can even associate it with a picture so that they recognize it better. Fluency wise, it's difficult to teach fluency, and fluency does not improve very much even in adult stage. Comprehension and vocabulary, it's basically a matter of the reader or the child interacting with the text on hand. So it requires an adult's presence and teaching them how to read and how to associate things and how the child interacts with the book, story book, or whatever book the child is reading. There can also be multisensory approach where the child reads things with different colored glasses, picture association. Kinesthetic as in they trace words on sand. Auditory is your audio books. Tactile is you can trace letters on back of the child and ask them to identify what it could be. You are trying to get them to read, because the problem is the child is unable to associate this printed form of word with the sounds and then hence comprehend the meaning, isn't it so? So you are circumventing that problem by using different approaches. A role of resource rooms in schools is very much important for children with dyslexia. They can attend mainstream schools, and only in subjects where they are finding it difficult, they can go to resource rooms where a separate teacher will help them understand the topic in a better way that is tailored for that child. Audiobooks, while they are reading a specific textbook, will help them put things together. It will help them understand things in the hearing format, in the visual format, and they will be able to visualize it in their brain. Later on, while the child becomes high school, college going, the most important resource is extra time, especially when they are sitting for exams. Say if somebody is given 3 hours time, a typical writer and reader is given 3 hours time, a dyslexic adult or an adolescent can be given extra time, so that the exam actually tests their ability rather than their disability. So that's about the treatment. What happens if these sort of interventions are not given? See, if these are not given, they end up having behavioral issues and school dropouts. They tend to have low esteem because they do not know what is wrong with them. They are unable to understand why they are being made fun of or why they are being scolded in school, despite doing everything else except the academics part of it. So that results in depression, generalized anxiety. They act out a lot. So if you do not want these issues, they need to be intervened early. That's it about dyslexia. Dyslexia is just atypical development or a atypical problem for the child in reading skills and writing skills. It's a specific learning disability, and it need not be, the children need not be segregated and put into special schools for the same. They should be put in mainstream school so that they can interact with other children of their same age, and other children learn tolerance and they learn to accept everyone as one of them rather than segregating them and how to tell. I'm able to think only in Tamil, not in English. Yeah, okay. So yes, so dyslexia is an important topic for your theory exams and for your practice also. When you are sitting in practice, I think you should be able to pick out children when mothers or parents come with concerns of poor scholastic performance. So thank you guys for listening to me patiently, and hope this has helped you understand what dyslexia is about. Share it among your academic groups, and all the best.